I'm Joelle Lester, Director of Commercial Tobacco Control Programs at the Public Health Law Center. We're based at Mitchell Hamlin School of Law in St. Paul, Minnesota, and I'm a co-author of the chapter on the Tobacco Master Settlement Agreement. It's hard to overstate the significance of the Tobacco Master Settlement Agreement, reached between the 4 major cigarette companies in 46 states. The settlement is known simply as the MSA, and it's still the largest legal settlement ever executed in the United States. The MSA came after 2 waves of litigation, starting in the early 1950s and continuing into the 1990s. These were lawsuits brought by individual injured smokers who were suing to recover for the harm caused by their tobacco product use. These lawsuits were based on different theories of liability and were almost entirely unsuccessful. Following that, in the mid-1990s, there was a 3rd wave of litigation. In this wave, state attorneys general sued the tobacco companies to recover the Medicaid costs incurred as a result of tobacco use by their state's residents. The Minnesota Tobacco Settlement Agreement, reached in 1998, was led by Minnesota Attorney General Hubert Humphrey III. This lawsuit recovered billions in dollars in Medicaid payments for the state of Minnesota and also forced the tobacco company to release millions of internal documents. And these documents showed that the tobacco companies knew about the risks and harms of tobacco use, publicly denied those risks and harms, and all the while were working diligently to make their products more addictive. Following the Minnesota Tobacco Settlement Agreement and 3 other early settling states, there was a push for a global settlement agreement. The Global Settlement Agreement would have provided for federal regulation of tobacco products and payments to government and private parties. In addition, it would have provided relief from punitive damages for the tobacco companies in litigation. But that agreement fell apart when Congress failed to enact the necessary implementing legislation. After that, the 46 states, 5 U.S. territories, and the District of Columbia reached an agreement with the industry on the less ambitious but still incredibly impactful Master Settlement Agreement. And now I'm going to turn it over to my colleague and co-author, Carrie Cork, to get into the details of the MSA.
I'm Carrie Cork, a senior staff attorney at the Public Health Law Center. The Tobacco Master Settlement Agreement required the tobacco companies to make annual payments to the settling states in perpetuity. It also required the tobacco companies to restrict their tobacco advertising, marketing, and promotion, to create a tobacco prevention foundation, known today as the Truth Initiative, and to make publicly available millions of internal tobacco industry documents uncovered in the tobacco litigation. In exchange, the tobacco companies received liability relief from state and local governments. The implementation of the Tobacco Master Settlement Agreement has proved a mixed bag. On the positive side, the MSA has succeeded in lowering youth and adult smoking rates by raising cigarette costs and by raising public awareness of the health risks of tobacco use through the work of the Tobacco Prevention Foundation. Also, the disclosure of industry documents paved the way eventually for the first federal regulation of tobacco and enabled many harmed individuals to pursue successful lawsuits against the industry. On the negative side, because the Tobacco MSA did not require that the funds be devoted solely to tobacco control and prevention, state legislatures have diverted MSA proceeds for non-tobacco control and prevention purposes, and this has resulted in a lack of sustainability of tobacco prevention programs. In addition, tobacco companies have exploited MSA loopholes in tobacco advertising and marketing and have continued to promote tobacco use. Also, although American Indians and Alaskan Natives suffer a disproportionate amount of harm due to the use of commercial tobacco products, the tribes were explicitly excluded from MSA negotiations, and this has resulted in enforcement, controversy, and confusion. Finally, Big Tobacco has expanded in the years since the 1998 Tobacco Master Settlement Agreement, as the settlement preserved the company's market share in the United States and allowed the company to focus on growing its revenue abroad. Ultimately, the MSA chastened but did not defeat the tobacco industry. Still, even that seemed unlikely for many in the tobacco control community in the mid to late 20th century.